Hello everyone, I'm Casey Wilson, and today we're going to be talking about dental disorders. These are my favorite quotes by Johnny Carson about dentists. Happiness is your dentist telling you it won't hurt and then having him catch his hand in the drill. For our course description, we're going to be looking at normal dental development, preventative health, dental disorders and pediatrics, and dental disorder treatment. For our course outcomes, by the end of the presentation, participants will be able to identify expected dental development in the pediatric patient. Participants will be able to identify risk factors for dental disorders. Participants will be able to describe various dental disorders that affect pediatric populations. Participants will be able to appropriately treat various dental disorders. Participants will be able to describe preventative measures to avoid dental disorders. So for these next slides, we're going to be looking at dental development, oral health with preventative care, and dental disorders. Dental medicine is a very large field. We're just going to be looking at caries and infections, things that we might see quite a bit in primary care. I know that during my last clinical rotation with the dental offices closed, we saw several people with dental issues. I'm sure several of you have as well. All right, so for dental development, teeth begin developing before birth. For proper development, so mother's nutrition is very important. The mother's diet should have calcium, vitamin D, vitamin C, and phosphorus. Mothers should try to avoid certain medications. A big one that I can think of is tetracycline, which can discolor the teeth of the babies. So children should have, when all their baby teeth come in, they should have 20 baby teeth. And then eventually 32 adult teeth, which includes wisdom teeth. So looking at the tooth, anatomy of the tooth, there is the enamel, which is the hard outer layer of the tooth. And it's actually the hardest material in the human body. And then there's dentin, which is the inner layer of the tooth. This is the main part of each tooth. The pulp is the soft part, the very middle of the tooth. It contains nerve tissues and blood supplies. And from the pulp produces dentin, and then the root, which anchors the tooth to the jaw. So teeth tend to first erupt between 6 and 12 months. Most of the primary teeth, or baby teeth, will come in by 33 months. The eruption sequence varies from child to child. Often the first teeth to come in are the central incisors of the lower jaw, the very front teeth on the lower jaw, followed by the 4 upper incisors, first 4 molars, the remaining bottom lateral incisors, the cuspids, and finally around the age of 2, the last 4 molars, or the 2-year-old molars, as you may have heard them. The sequence is highly variable, but generally it is a good idea to talk to a dentist if teeth have not begun to erupt after 1 year. So this is a slide that shows all the baby teeth. There's 10 teeth on the top, 10 teeth on the bottom, and this shows the age in months that the teeth on average come in. So we can see the central incisor, this says average 7.8 months. It's the first teeth to come in. And then this is the age teeth are lost in years. So about 11 is the oldest, but of course it varies from child to child. So your primary teeth start to be lost around age 6, and the last permanent teeth will be in around age 12. There are 32 adult teeth. This includes the third molars, which are also known as wisdom teeth. Third molars often erupt older in people, usually between 17 and 21 years old. This can be variable. Some people don't have third molars, or they'll just have, 1 or 2, less than 4 teeth. It just depends on the person. And often they are removed due to crowding in the mouth. This is another slide that shows the adult teeth and the age that they come in years. So we'd see there's 6 years old to around 12 years old, and then 17 to 21 for the third molars. So next, we're going to be talking about oral health. Oral health is important in the overall health of infants, children, and adolescents. Oral health often reflects general health. Oral health promotion and disease prevention covers dental caries, periodontal health, development and alignment of facial bones, jaws, and teeth. Caries is one of the most common chronic diseases in children. It is 5 times more common than asthma. If left untreated, pain and infection from the caries can cause problems eating, speaking, and learning, and can cause developmental delays in children. Children may miss school and miss out on learning. Caries is preventable and transmissible, and it's an infectious disease caused by bacteria that form plaque on tooth surfaces. The bacteria interact with sugar in food and beverages and turns into acid that dissolves the enamel of the tooth. Dental caries are, according to this source, actually the most common chronic childhood disease. The 23 to 56% of children aged 6 to 8 having caries. So the importance of a dental home, it's important for children to have a dentist. Children come to see you in the office, it's good to make sure that they're being followed by a dentist, that they're having regular checkups. So parents are encouraged to establish a dental home for their children no later than 12 months of age. This may seem kind of young to many of you, but research suggests that if children are older, or quite a bit older, they actually will have more complications, more procedures, and higher healthcare costs if they go when they're older. The dentist can maybe catch some problems before they become big problems. So we can talk about fluoride, which is good for preventative health. Fluoride is important in preventing and controlling caries. Fluoride reduces the loss of minerals from tooth enamel and promotes replacement of minerals that has already been lost or been damaged. Frequent exposure to small amounts of fluoride is the best way to get fluoride. Fluoride is in like city drinking water. If you have a well, you get your water tested, and kids may need to have fluoride supplements, fluoride toothpaste. Fluoride supplementation is not needed in the first 6 months of life, but after this, the children who do not drink fluorinated water should be given supplements. After the first tooth eruption, fluorinated toothpaste is recommended. Children's teeth should be brushed twice a day with a soft bristled toothbrush. I actually read when reading into this to brush the children's teeth after breakfast and then before they go to bed. Infants up to age 3 should use a smear no larger than a grain of rice. You don't want them to swallow too much of the fluoride. Ages 3 to 6 would use a pea-sized amount of toothpaste. It's good to start a good routine with children and get them to brush their teeth from a young age so that they carry that throughout their life and take care of their teeth. So dental disorders, what are caries? So dental caries is the process of tooth demineralization which leads to cavitation. Bacterial metabolism of carbohydrates produces acid, which begins this process. If this is present in a child less than 6, it is known as early childhood caries, or ECC. And then also we're looking at dental infections. A dental infection is acute or chronic inflammatory response of the dental pulp, pulpitis, related to an invasion of bacteria secondary to caries or trauma. Infection can lead to necrosis of the pulp and cause an abscess. So on the slide you see there's reversible pulpitis, which can be reversed often with dental procedures with placement of a filling or cap. Irreversible pulpitis leads to necrosis of the nerve and abscess formation. So, dental disorders, some of the risk factors. So, we're looking at two different things. So, dental caries, increased sugar on teeth for long periods of time, frequent sugar consumption, prolonged bottle feeding, medications sweetened with sucrose, inconsistent brushing or flossing, pouching food, teeth that are close together and hard to clean, having a dry mouth, and factors that can cause a dry mouth, mouth breathing, albuterol inhalers, psychiatric medications can all dry out the mouth. Weakened tooth enamel, lack of fluoride in the diet, developmental enamel defects, low socioeconomic status, and low socioeconomic status. This what I found in this article is 56.3 of children below the federal poverty level have dental caries, while 34.8 of children with income levels 300% of the federal poverty level have dental caries. So there's a 20% difference in children with dental caries. So it's a major issue with dental health. So previous caries, you're more likely to, if you've had them in the past, you're more likely to get more infection with mutant streptococci and lactobacillus species. So, and also another risk factor with dental caries is developmental delay, cerebral palsy, conditions requiring frequent high nutrient oral diets, conditions that are treated with medications that dry the mouth, such as psychiatric medications. So if children are unable to brush their teeth, or it's difficult to brush their teeth, they could definitely be more likely to form dental caries. And some risk factors for dental infections. So a poor diet with a high sugar diet, poor dental hygiene with visible plaque on teeth, dental caries, low socioeconomic status, just like the previous for dental caries, and then lack of a dental home, lack of access. If you're unable to go to the dentist, it's more likely for you to get infections because you're not having preventative treatment done. So the pathophysiology for dental caries. Dental caries develop when bacteria, mutant streptococci, ferments carbohydrates into acids. These acids over time will demineralize the tooth enamel. If tooth enamel is continuously demineralized, it will lead to cavitation. For dental infections, the pathophysiology is dental infections are usually a result of advancement of dental caries from the enamel and into the dentin and then into the pulp. Dental infections are an advancement of the same disease process as dental caries. As the caries progress, bacteria can invade the pulp, and this causes an inflammatory response. Necrosis occurs and forms an abscess in the root, resulting in bone destruction. The infection may remain localized and drain through a sinus tract that forms, or it may spread into the marrow and into the surrounding tissue. Many abscesses are self-limiting, but they can actually be life-threatening. It can grow and cause significant problems. And dental infections, maybe they don't sound, deadly, but and it's a routine thing we see pretty frequently, but they can be deadly. There's a recent case of a 7-year-old boy that had a brain abscess related to an untreated dental infection. That was earlier this year. So for subjective questions to ask for dental caries, there are cards. When did it start? Where does does it hurt anywhere? How long does it? All the time? Does it come and go? Some characteristics of it. Does anything make it better or worse? Irradiation, any pain radiation? Have you taken any medicine for it? How bad is the pain? Or the setting for the pain? So dental pain, and then we might want to ask them how many beverages containing sugar do they drink a day? Do they eat a lot of candy? A lot of or just other sugar or carbohydrate consumption. Any sensitivity to hot or cold foods, sensitivity to sweets. This could clue us in that maybe they have caries. So past medical history, allergies, immunization history, review of systems for ear, nose, and throat especially. And then for dental infections, for questions, subjective questions to ask, we would do the same as above. Any fever, any waking up at night due to pain, any swelling noted, any if it's reversible pulpitis, pain subsides with when the stimulus is removed, hot or cold. It'll go away. With non-reversible pulpitis, the pain is constant and dull. So for a physical exam, for dental caries, you'll often see discoloration of the teeth. It's chalky white, and then progresses to yellow and then brown. This might indicate that there are dental caries. Some soft tissue swelling. Dental instruments can help to confirm this. The location of the cavities is of any cavities that form may be between the front incisors, the biting surfaces of teeth, and at the gum line. For dental infections, lymphadenopathy, there's some swollen lymph nodes, facial asymmetry due to swelling. One side may be more swollen than another. Maybe some swelling inside the mouth. There may be a sinus tract or fistula adjacent to the tooth. There may be some, drainage. May be difficult to open the mouth for pain and swelling. Tender to palpate, and they may have a fever. Subjective, dental caries, dental discoloration of the teeth may be noted, as we talked about earlier, and then localized swelling. And then for dental infections, we'll see fever, swelling, purulent drainage may be noted, tender to palpation. Analysis. So for medical diagnosis for dental caries, some differential diagnosis we could consider: dental tartar formation, just dark staining from iron supplements or tea, or just developmental tooth defects. For dental infection, some differential diagnosis we might consider: reversible pulpitis, gingival foreign body, abscess, ulceration, or just an eruption of a permanent tooth in children. And nursing diagnosis could be related to knowledge deficit. For the plan, so for dental caries, Tylenol or ibuprofen. For symptomatic pain, follow up with a dentist. Timely restorative care by a pediatric dentist can help to reverse the dental caries. Make sure the patient is getting appropriate fluoride of the drinking water or supplements or with toothpaste. Fluoride is definitely important. Treatment by removing a primary tooth or a root canal if needed. Proper oral care, brushing and flossing like recommended twice a day. First dental visit at 1 year old, and then every 6 months throughout childhood. Dental infection, plan for that. Consider antibiotics with symptoms of nocturnal pain, waking up at night, having fever, lymphadenopathy, or swelling. So our first line antibiotics for a dental infection are amoxicillin, 20 to 40 milligrams per kilo in a 24-hour period, divided into 2 doses, or augmentin, 25 to 45 milligrams per kilo in a 24-hour period, also divided into 2 doses, and then Tylenol and ibuprofen, also for pain relief for dental infection. Second line antibiotics include clindamycin and azithromycin. We'll need to follow up with a dentist and may need a root canal or tooth extraction. So for patient education for dental disorders, as mentioned before, dental health is very important. Dental health also often reflects the overall health. So if a child has well taken care of teeth, then their overall health is likely to be better. First dental visit at 1 year old. Having a dental home, a regular place where they can go to the dentist, is important. Dental cleanings and checkups every 6 months during childhood is important, and on into adulthood. Just continue that trend, and then proper fluoride intake to reduce caries. Brush and floss teeth at least twice a day using fluorinated toothpaste. If caries or infection is suspected, follow up with a dentist as soon as possible. Restorative care can help reduce the effects of dental caries. With any pain, swelling, or fever, seek medical care. So in summary, proper dental health is important in caring for pediatric patients. Proper dental care from a young age can have a positive health effect on the patient for the rest of their lives. And tooth eruption begins around 6 months old. Children have 20 teeth and eventually 32 teeth when they're an adult. Fluoride is important for dental health. Children should see a dentist at 1 year old and every 6 months. And then dental caries and infections should be treated when indicated. So for the learning activity, I'll put this on the post, so follow this, the link. Just a dental anatomy game. It's been a while probably since we've reviewed any dental anatomy, so this is actually a fun little game that helps you with dental anatomy, the different teeth and everything, parts of the teeth. And these are my references, and that's it. Thank you very much.